Bueno, de nuevo, muy buenos días para todos los que ya están.
So once again, thank you to everyone who's here in the room. This is our last week in our Climate and Health Responder course for Latin America.
Pues simplemente recordar que
I would like to remind you that this course has been developed and organized by the Global Consortium on Climate and Health Education, led by the University of Columbia, also by the Inter-American Institute for Global Change Research, and by the Pan-American Health Organization. As we have always told you, you can take the course in English or Spanish. You have the option to choose languages at the bottom of the screen. So that you can access the interpretation. As I've said before, this is the final week of our course. We have today's session and Thursday's session as well. Today, we will be talking about climate adaptation and mitigation, and we'd like to focus on the benefits. We'll have two great speakers. First of all, Dr. Carmen Ciganda from the Ministry of Public Health, Uruguay, and also Dr. David Rojas Rueda from the Colorado State University. I would like to remind you of the logistics. First, we will have a 90-minute session, 70 minutes of content and 20 minutes of questions and answers. Please write your questions in the Q&A section in Zoom. Remember that every session is recorded and posted within 12 hours. And everything is available on the course website. And of course, we recommend readings, and hopefully you've read all this before the course, but if you haven't, that's fine. The readings remain available on the course site. This is a site where you can find all the resources we have developed, the presentations, and also case studies. First of all, we have Dr. Carmen Ciganda. As I was saying, she works at the Ministry of Public Health of Uruguay. She's a physician, a toxicologist. She's a specialist in environmental sciences, and she has a degree in public health. She has worked a lot in the ministry. She has held several positions. She has been the environment director, and she has been the focal point regarding climate change, not just within Uruguay, but also in the Mercosur region. She has led the adaptation strategy within the Mercosur, or Southern Common Market, when Uruguay led the group. She is currently an advisor on environmental and labor health policies at the Ministry of Public Health in Uruguay. Welcome, Carmen. And as usual, it's an honor to have you here in this course. Now I would like to introduce David to make the most of our time. David Rojas is an environmental epidemiologist. He works at the Colorado State University. He has worked with several multilateral organizations, the World Bank, WHO, and PAHO as well. And he especially focuses on urban planning and the planning of transport systems. Today he will be sharing a study case on that topic. Welcome, David, as well. Without further ado, thank you again for being here and for, of course, paying close attention to these lessons. Now I would like to give the floor to Carmen. And please, dear speakers, remember that you have, Carmen, you have 50 minutes for the first presentation. Thank you very much. Carmen, you have the floor. Thank you, Shilma. Good morning, everyone, or good afternoon here in Montevideo. But here in Montevideo, it's 11 a.m. I'll share the screen now.
¿La están viendo? Bien.
Sí, estamos bien.
Perfecto. Y modo pantalla completa. Perfecto.
Okay, full screen.
Bueno, el tema que tenemos hoy es adaptación y mitigación.
So today we are focusing on climate adaptation and mitigation and co-benefits. Learning objectives for today. We want to learn about the concepts of adaptation, climate adaptation and mitigation, an analogy with the health prevention levels, which health sector adaptation and mitigation actions we need, and the health co-benefits in other sectors. So these are the benefits that other sectors can create when they implement their mitigation plans. These are definitions taken from the IPCC. Adaptation. In human systems, it is the process of adjusting to actual or projected climate and its effects in order to moderate harm or take advantage of beneficial opportunities. What does it say take advantage of? Because sometimes there's a temperature increase and that improves winter conditions for vulnerable populations such as adults. And in that case, that may be a benefit. It's better to have a more temperate weather. However, in general, the impacts of climate change are negative and not positive. The Pan American Health Organization and the World Health Organization define adaptation measures as those aimed at reducing the vulnerability of natural and human systems, minimizing the impact and reducing the adverse effect of climate change. This is not new within health or for us and within health policies. When we deal with a health issue, and not just because of climate change, and we need to implement risk reduction measures. For instance, when we deal with a drug addiction, we try to get consumers not to do drugs, but in the meantime, users are provided with syringes, for instance. Or, for instance, providing people with condoms in order to prevent the transmission of sexually transmitted diseases. It's very important to consider our capacity to adapt. We need to remember which adaptive capacity we have. The ability of systems, institutions, populations, and health services, people, and others to adapt to these potential damage and to take advantage of opportunities or cope with the consequences. And it's also important to know which adaptation options we have as we plan our position to face the impact. Of course, we can have a number of strategies and measures available in order to face those adaptation needs. These measures or options or strategies may be structural from a macro perspective or institutional when we focus on just one institution. They can be ecological when we analyze the environment in a cross-cutting manner, for instance, biodiversity, or it might have to do with people's behavior. For instance, today in Uruguay, we have an orange alert because there's an extratropical cyclone in Montevideo, Maldonado, and Rocha along the coast of Uruguay. So alerts, warnings were issued, don't leave your home if you don't need to, etc. we must also consider vulnerability, the vulnerability of these populations and of the people that we are focusing on in order to adapt. So vulnerability, the degree of susceptibility of a natural social system to withstand climate change damages. Regarding its magnitude, the sensitivity of the systems to climate change, and the ability of the system to adapt to such changes. Throughout the course, we have seen that a highly vulnerable system is a system that is very sensitive to minor changes in climate and whose adaptability to adapt is severely limited. Health, environmental determinants, it's essential to consider them because we are exposed to multiple factors within our home, our community, our place of work, and not just to climate change, because we are exposed to these risks simultaneously. For instance, there can be situations as well, or environmental systems. For instance, urban environments, housing, roads, our infrastructure when we consider adaptation. If there is a problem, if an isolated community can be reached quickly or not, if we have the necessary tools to remove fallen trees, for instance, or maybe there isn't an emergency system in a given community, but we need to reach them. We need to be able to get there, and the whole community should actually hear this message. Of course, agricultural practices, labor risks, workers because of the work they do. For example, a chemical factory, when they have to travel to their job, noise, environmental noise, etc. And there are other environmental determinants such as radiation, chemical agents, water, sanitation and hygiene, air pollution. These two are very important and they are intrinsically connected to climate change. Okay, we should adapt, but adapt to what? To what we have seen throughout these weeks. To every change or impact we have seen, a global warming, a temperature increase, heat waves, floods, droughts, sea level rise, polar cold waves, hurricanes, fires. These are direct impacts because the population is impacted immediately, the populations that are exposed. People have died during a cold wave. Yesterday in Uruguay, a tree fell. Actually, it was a palm tree that destroyed a young man's house and he was killed. That's a direct impact. But there are also the effects of the response to climate change. For instance, an increase in average temperature means that some areas have now become tropical. In the past, in some areas, it was unthinkable to have dengue or malaria, and now they do have the mosquitoes that carry dengue, malaria, or chikungunya. So these areas or systems become more vulnerable. And of course, they need to sustain increasing temperatures and also deforestation and its consequences. So there is, this whole mess within ecosystems, biodiversity, species abandon one place and colonize others. And of course, ecosystems that are favorable for algal blooms. For instance, the changing levels of nitrogen or phosphorus in a given water source is impacted by human actions, for instance, through the use of pesticides that added to heat, water, floods, droughts. This, of course, favors the proliferation of algae in salty and fresh water that impacts the water we consume and also recreational water. And of course, waterborne diseases. For instance, hepatitis when there is a drought, leptospirosis when there are rains or floodings. This has been shown as well in the last few weeks. And there are also impacts as a consequence of climate-induced economic transformation. For instance, if there is hail right before harvest, that harms the whole harvest. Food will be more expensive. Some people will be able to afford it, but most won't. And that is added to the unsustainable use of land, monocultures, also biodiversity loss, you know, the story of seeds, environmental degradation, etc. So there are three main determinants that we need to consider when we talk about the impact of climate change and what we should adapt to. In the last few weeks, in this course, we have seen quite a few things, and this is just like a reminder chart. For instance, extreme temperatures, thermal stress that affects the population's health. There are no new diseases related to climate change. It's the usual diseases we've always had, or that we've had in the world, maybe in some areas. There are some diseases that now appear in other regions. We do have the vector. It's unthinkable. I think that at the School of Medicine, we weren't even taught what malaria was. But now we need to remember that non-communicable diseases such as cardiovascular disease or respiratory diseases will be exacerbated as well. Also allergies to pollen because there is particulate matter, and if it doesn't rain, it remains in the air. And when it rains, it sends the matter into the ground. Also cold waves, heat waves, floodings, droughts, hurricanes, landslides. Whole cities have been affected, or communities have been affected, fires as well. And that also affects cardiovascular disease rates, and there have been fatal accidents. And this has an impact on the physical and mental health of people, also the risk of malnutrition. We have all have seen people that are evacuated because of floodings or fires. And who should be responsible for the family? It's usually women or elder sisters, and they quit work, they quit their studies, and that affects the whole family.
They have to be directed to a tent or a gym and make sure their stuff doesn't get stolen, and they face malnutrition because they are used to a certain diet, but then they need to feed a bigger crowd. And of course, we need to speak about waterborne diseases, infectious diseases, diarrhea, cholera, leptospirosis, typhoid, hepatitis A, and others, and vector transmitted diseases or infectious diseases, dengue, malaria, chikungunya, Zika, yellow fever, Chagas, leptospirosis, among others. So considering how vulnerable people and populations and systems are, and their adaptation capacity. Some of them will have a better response to a heat wave. They might go on holidays, they might travel around their own country, other countries, they might go to the beach, others might have to go to work, but they have AC systems. Others will have to work outdoors at the worst times during the day. They might have personal protective equipment or not. They might have a protocol in place stating which time they can work outdoors and they might not. And there are different responses in the different communities. I don't know if the pictures are clear, but right here we can see a high income, what it seems like a high income community, nice homes, and they were flooded. But they are using boats for transportation, probably their own boats, and I'm sure these homes do have insurance that will cover all of the damage. But what is clear is that these two children right here, they might not have a nice home or entrance. They might have tin houses, and they are carrying, as you can see, whatever they were able to take with them, a mattress and little else. They will face great adversity due to flood or any of the other impacts, cold spells or any other. So it is important to see that if we do have the opportunity to stay home, you can stay home. If you don't, well, you have to go out, and then you do have warm clothes, or you don't, and you might be homeless and live in the streets. So what is the community's capacities to respond? Sometimes the cities have structural problems, and it is the municipalities that might provide shelters for those who are homeless, because this is a chronic problem, a problem that existed before climate change. It is a multi-factor and multi-cause problem. So we need to consider medium and long-term measures to resolve it. This picture shows a healthcare center. Do we have access to this center or not? Do we have a primary care system in place? Do we have adaptation measures in place? For example, vaccination. If we want to prevent respiratory diseases, communicable diseases, viruses in the winter, so we might have vaccination rollouts or vaccination campaigns, which we need to purchase in advance. So adaptation, it is important to remember that we need to prepare for adaptation. Most of our actions, most of our efforts will address emergencies or urgencies. But what is important to remember is that we should not just manage crisis. I mean, we do have to manage crisis, but we need to manage risks to get ready for adaptation and adaptation efforts. It is also important to see where we are standing and where we are heading. What do we want to achieve with our adaptation measures? For those of you who are not in healthcare, let me just say that when we have to face a certain or a potential disease, there is always a pre-pathogenic period. Our body poses certain resistance, we are healthy. So to prevent disease in the pre-pathogenic period before the onset of the disease, when there is a balance between the infectious agent, it might not be infectious, it might be tobacco consumption, for example, for smokers, or heart disease. But there is a balance between the agent, the environment, and the host. This is the ideal time. I don't know if ideal is the word, but this is when we should have primary prevention practices in place, education for health, promotion of our health at all levels, primary, schools, workplace, healthcare centers, and also across all levels of care and attention. So how does the healthcare sector react? How does the primary care level react? Maybe I can detect people who are vulnerable to a certain condition. And then secondary level of care is when, for example, we have it at second level healthcare centers or tertiary tertiary level. But going back to prevention, when the pathogenic period is already in place, we might be able to recognize a subclinical period or a pathogenic clinical period that can be observed. In the subclinical, there's not yet an onset of the disease, it is asymptomatic. Now in the clinical period, it is already manifested. So we have to put in place secondary prevention measures, early diagnosis, treatment, and to stop the progression. And what could be the outcome? Well, the patient might recover, they might become chronic patients, they might become disabled, or even lead to death. And this is a tertiary prevention measure where our options will be rehabilitation, or integrating people into their household, their employment, society. So there will always be some sort of prevention effort to put in place. What it is ideal is to prevent disease, disability, not just because we want to promote health, but also the impact, the economic, financial, and the burden. It is more expensive to treat a community that is a disease than preventing disease in our community. What are our adaptation measures? How do we adapt to climate change, to the impacts of climate change, to the effects already in place or the potential impact? One of them that has already been mentioned a few times by the other speakers is to produce climate change training programs. This course in particular is an adaptation measure to climate change. Why? Because we are training, we're producing information, we're raising awareness. This will in place allow transfer of further knowledge and information in your own community, in your own workplaces. So this is a great adaptation measure because we are training and producing knowledge on climate change. Training and raising awareness should target all audiences. But when we are training the community, we need to use a type of language that is understood by everyone. We need to do everything that we have heard about in the past 2 weeks. We need to develop early warning systems in the face of adverse events. All the speakers discuss different hurricanes, cold freeze, heat waves, temperature increase, different diseases. So how can we establish a connection between the climate sector, meteorology sector, and the healthcare sector? We need to develop health, environment, and climate change indicators. So we all produce disease reports, surveillance units, report to ministries, but it's not just about reporting the 4 cases of leptospirosis in our community, but we need to use robust indicators to indicate what is the month of the year, what are the environment and climate circumstances, what is the background information of that community, do they live in flood-prone diseases, are they rural workers, and so on. Determine the burden of the disease, how many years of life is that person losing due to that particular condition. And of course, if they die, how many years have they has the head of this household lost, and they will not be there any longer to raise their children or to earn a wage. We need to develop or to fit predictive models of the diseases that are associated to climate change. Sometimes it is very difficult to develop adequate predictive models because one solution does not fit all. One model developed in one country might not fit other. For example, the dengue predictive model developed in Brazil was not fit for Uruguay because we did not have any local cases. We did have imported cases at some point. Then we did observe local cases, but then we put in place different campaigns to eradicate dengue and to eradicate the larvae and mosquito. Well, and also to have prevention plans, whether vector-borne diseases or climate-sensitive diseases and non-communicable diseases. And also we need to strengthen vaccination programs, immunization programs. Other adaptation measures raise awareness on climate-sensitive communicable diseases. I mean, we don't want to promote that. We want to promote the programs that attempt to mitigate chronic and climate-sensitive diseases. We have to map vulnerabilities to know where to focus or to address the adverse effects. For example, one sector in our community might be flood prone, other might be more vulnerable to heavy rains or fires and so on. In other areas, they might be affected because there is a larger illegal or settlements in the outskirts of the city, or because there is a larger community of older people. To protect and to promote safe infrastructure, we need to incorporate the WHO water quality guidelines, air quality guidelines, to learn what the risk levels are. So when discussing with the Ministry of Environment, the Ministry of Industry, and the other agencies that will monitor environment quality, we need to make sure that the WHO water and air quality guidelines are complied with. And this goes hand in hand with an intersectoral coordination for climate risk reduction and disaster risk reduction and response. We need to work together with the agencies that build roads, that are in charge of land use planning. For example, which materials to use for buildings and constructions for them to be safer, and to develop national adaptation plans for the healthcare sector, adaptation to climate change. And these should be incorporated into the climate change adaptation national plans. And we will now look at a poll.
Bueno, perdón. Bueno, perfecto, me fui para adelante,
I skipped a few slides,
perdonen. Y genial, me parece muy bien.
and I think it is
74%
great. 74%
que ha votado que todas las respuestas
has said that all of the
y
above
los que
are
votaron las
correct.
demás, no se preocupen
Those
porque
who
están
voted for the other ones, they are okay. I mean, they are part of the answer. It is fine that we warn about extreme events, to identify vulnerable groups, to promote contingency plans, and to strengthen all of these systems. All of those are adaptation, climate change adaptation measures to adopt.
Pasamos ahora, entonces,
So let's now turn to mitigation.
entonces, si adaptarnos era
Adaptation means
nuestra respuesta al impacto del cambio
devising a response to the impact of
la
climate
mitigación
change, what is already
está
here or
de
what
acuerdo
will
a
happen.
la definición
Mitigation,
de
according to
los
the
países,
IPCC
es
definition,
mitigar
is
la
to
causa.
mitigate
¿Cuál es la
the
causa del
cause.
cambio climático?
And what is the
Los datos
cause
lo
of
dicen.
climate change?
Muy bien, entonces la
GHGs.
mitigación
Okay, so
son todas las
mitigation
intervenciones humanas
means
destinadas
all human
a reducir
activities
las emisiones
devoted
mejorando la
to
biodiversidad de la
reducing GHG
las políticas de
sinks.
mitigación, la
So
reducción
mitigation, reduction of
en el
GHG
contexto de la política climática
in a context
tiene
of
que
a
ver
climate
con todas
policy
aquellas
have
medidas
to
de
do with
tecnología,
all of those
procedimientos,
measures,
prácticas
technologies,
que contribuyen
processes, or
a esa
practices that we can
mitigación, a
adopt
evitar
to help
el impacto
mitigate
tan
or to
drástico del efecto
prevent
invernadero.
the
Bueno,
emission
todo
of
lo que tiene que ver
GHGs.
con la energía renovable,
So renewable
procesos de
energies,
minimización de desechos,
waste minimization processes, or practices that promote the use of public transportation, for example, are measures that will reduce GHG emissions.
Esto está tomado de cualquier país, no importa.
This is taken for any given country.
Global,
This is a global pie chart that shows
la energía es la que se lleva
energy or power
la gran pedazo de torta, ¿no?
accounts for the biggest slides of this pie,
De electricidad de la emisión de gases de efecto invernadero que se
for the
soporta
biggest GHG emitter sector,
seguido del transporte,
followed by
eso varía en
transportation,
países y
and then, well, depending on the different countries,
su economía
the economy of that country might be
van todo
mainly based on agriculture or other sectors, waste management, biomass burn, and all of the GHGs that we are generating at home, what we eat, what we consume, transportation, what we use for heating. For example, we might use biomass for heating, wood, charcoal, or electricity even. So we all contribute to GHGs, and we will not go into that discussion right now, which is the highest emitter country or not, but all of the different GHGs have an impact on climate change. So what is the contribution of GHGs on the healthcare sector?
Because health services are not included here. But actually, we do use electricity. We have several industrial processes, especially at the third level of care. We also process waste, or we pay people to do so. We use transport as well, because health staff, unless they go to work by bike or live next to the hospital, they need to, you know, take the bus or have a car also ambulances that transport patients, also cars for health staff, social service, etc. Of course, the COVID pandemic changed this drastically. When we told people stay at home, we'll come see you. We wanted to prevent patients from coming to hospitals because there was a high risk. But of course, we needed to go to their homes to, to run COVID tests, etc. So this is the health sector's contribution to greenhouse gas emissions. This is a publication by Salud Sin Daño. It says that if the health sector were a country, if we were to put it all together, the health sector would be the fifth largest sector responsible for GHG emissions. So you can imagine how we need to coordinate our work with other sectors in order to mitigate our GHG emission rate. It is estimated to be globally between 4.4 and 6% of GHG emissions, especially carbon dioxide. Which mitigation actions can we take at our clinic, hospital, or service, at our NGO, if it's a social organization, or wherever we work with health or health policies or programs? What can we do in order to curb our GHG emission rates? First of all, energy efficiency practices. We can install renewable energy sources. If we have them already, we can use them more. It's not often, to install a solar panel, but maybe you can coordinate your work with other sectors, or we can switch to more sustainable energy. Also, more efficient lighting and heating systems, buying renewable technology. Sometimes we, call for bids and we tend to buy the cheapest technology. Now we need to consider this. We need to say what will be scored the most, because that will favor health in general. It's something we do now that will have consequences in the mid and long term. We should also try and use more efficient transport. We should adopt practices to promote the use of public transport. For instance, there could be carpooling. People can get together to drive somewhere. We can provide students or patients with bikes, or workers with bikes as well, if they live nearby. We can, enter into agreements with communities, municipalities. We can also have a green purchase system. We can buy, for instance, we can buy technology for the place where food is prepared for workers, students, etc. We can enter into agreements with local providers. Sometimes we eat food that comes from a different continent. And okay, that's fine, but it's also highly contaminating, to transport goods over an ocean. That is very costly. If you buy your food from your neighbor, you cause less impact transport-wise and energy-wise. And of course, food is healthier and it comes from our producers. We should also think about managing those services, how we are going to dispose of hospital waste. We used to burn this waste in the past, but that's no longer possible, of course. There are management and treatment systems, and also treatment varies according to different practices. And waste cannot just be disposed of at any landfill. We need the necessary regulations. So we need to work with transport, with local government, with companies, with the Ministry of the Environment and the Ministry of Industry. We also should create a policy that reduces and minimizes the waste. We have also discussed the importance of the administrative area within health. For instance, they need special paper to use with patients, and some types of paper are not contaminated and they can be reused. Also, for instance, saline containers that use so much plastic. But there's some plastic that is not biologically contaminated and that can be reused. Of course, we're not going to make a milk bottle for a baby with plastic coming from a hospital, but you can manufacture garbage bags, buckets, etc. Carmen, you have 8 minutes left. Okay, thank you. Mitigation measures within the health sector. There are two major tools. First of all, the PAHO's guidelines for smart hospitals. And there is another WHO tool, the establishing health centers that are climate resilient and environmentally sustainable. They deal with sustainable waste management. They focus on energy as well and on infrastructure, technologies, and products. There are many tools, checklists, and toolkits that you can use. Mitigation is important as a health determinant. What should we consider when it comes to implementing mitigation actions? We need to adopt or revise national air quality standards, for instance, according to the WHO air quality guidelines. Some things we can do ourselves and other things must be done by other people. For instance, coordinate intersectoral air quality monitoring. We need to consider where we have particulate matter. We need to support the transition to clean energy use in homes for cooking and heating purposes. This is not done in the health sector, but we should support and educate our patients and users. We should promote safe and accessible public transportation systems. We should encourage stricter emission standards. And we have an essential role because it is us who need to tell people that they should be implemented. And we should also promote proper waste management. What are co-benefits? Co-benefits are positive effects that a policy or measure aimed at one objective could have on other objectives. So it's something that has a purpose, but that had a positive effect on something else. And in this way, co-benefits benefit everyone. Co-benefits are often subject to uncertainty and depend on local circumstances and application practices, among other factors. So co-benefits are also called accessory benefits. We should remember the One Health perspective as set forth by the WHO. Animal health, human health, and the environment. It's just one health. If we work on one of these aspects, we will have consequences on the other. Health co-benefits on other sectors. For instance, when we work with the public transport strategy, we have fewer cars because, I don't know, everyone takes the bus, we don't use cars. We have lower CO2 emissions, the air quality improves, traffic congestion improves, people walk more and exercise more. There is improved mobility because there are fewer cars. That decreases the prevalence of respiratory diseases Also, number of injuries because of car crashes. It also improves rates of non-communicable diseases such as diabetes, obesity, respiratory diseases, cardiovascular diseases, etc. And it also promotes health equity. Other strategies: reforestation, public parks, community gardens, and urban agriculture. There is carbon capture that helps preserve species, improves biodiversity. It reduces solar radiation because the green coverage sends it somewhere else. There's a reduction in CO2 emissions. There are more green spaces, air quality improves, we have access to green spaces, and this also improves urban heating or cooling systems, and that improves mental health and social well-being. It reduces respiratory disease rates, and it improves mental health conditions. Another strategy, cycle lanes. We have fewer cars, we have lower CO2 levels, air quality improves, we exercise more. It has a positive impact on every aspect. There is a decrease in respiratory diseases, non-communicable diseases, and improves our mental health and social welfare. Regarding another strategy, resilient crops and agroforestry. Small gardens or farms in cities, community farms as well. This favors a sustainable agriculture system. They are huge carbon sinkers, so they reduce CO2. It improves food production, access to food, air quality. It improves our nutritional status. It reduces respiratory diseases and improves NCDs as well. Another strategy, green roofs and walls. There is solar radiation diversion. It improves water quality. It also creates carbon sinks. It promotes the natural preservation of biodiversity. It reduces heat islands and the shadow effect. There is flood reduction, CO2 reduction. Biodiversity improves, urban cooling improves. Also, there is system pressure reduction, improved air quality, access to green spaces, and this has a very positive impact on people's health because it reduces the prevalence of heat-related diseases, it improves mental health and social well-being, it reduces respiratory disease rates, and improves people's mental health and social well-being. Zoom poll question. Adaptation measures in the health sector, choose only one. Improve energy efficiency, should focus on renewable energies, promote public transport and sustainable mobility, promote the development of cycling lanes to use bikes, promote sustainable agricultural production, promote biodiversity protection, entail co-benefits for health, and all of the above are correct. Thank you.
Genial, genial. También, no se sientan mal los que contestaron.
Yes, great. Don't worry if you just chose one measure, because all of them are true, actually. But generally speaking, as all of them are correct, they were all correct. So thank you. Finally, I'd like to remind you that we should consider the 72nd World Health Assembly to be held this month, today or tomorrow. People are flying to take place. The Health, Environment, and Climate Change Global Strategy has been adopted. Please go over it because it has major strategic objectives in the topic of climate change, but also primary prevention, the environment, health, We need to take into sectoral actions. We need to strengthen the health sector with leadership and governance functions. We need to make the most of this boost provided by the COVID pandemic, unfortunately, because everyone now focuses on health, scientists, communities, the academia, etc. So let's harness this. Let's create more support. Let's strengthen scientific evidence. This course is amazing because we have such amazing scientists, and we have a great presentation after this. We should always provide each other feedback, and we need to always remember the Sustainable Development Goals. And here we are, objective 3, goal 3, health and well-being. Number 6 is also important, 7 as well, number 9 as well, industry, 11, cities, well, of course, 13, climate action. All of them are affected by health, because if we do not fight our poverty levels, then climate change will affect us much more. We need to improve how our communities eat. Otherwise, we will have more diseases, and communities will be less resilient and won't be able to adapt to climate change. The same applies to access to work, housing, and also, justice and equity within our governance systems. Here we have the first objective of the WHO strategy, promoting health. We need to remember the great documents we have, the Ottawa documents, for instance, regarding the first level of care, which needs effective governance in order to allow everyone to choose affordable health options. Also, our city, our environment, and the environment where we live, where we work, where we have our leisure time should be sustainable. Also, we should be able to have access to knowledge on our health. We should improve this knowledge and social skills. We should empower our communities, our users, so that we have more equitable health. Thank you very much. Thank you, Carmen. Your presentation has been excellent. Now, I would like to give the floor to David's presentation, and then, of course, you're invited to turn on your camera again so that you can answer some of the questions that the participants are asking. Thank you very much. David, welcome. You have 20 minutes. Thank you. I am David Rojas. I am an epidemiologist. I'm a professor at the university, at the Colorado University State. Today, I would like to talk to you about the following. These are our learning objectives. We have 20 minutes and we'll be discussing examples from specific sectors that have been designed to mitigate climate change and how health impacts and co-benefits can be quantified. We'll be seeing some real cases of where we have quantified the co-benefits of interventions, and this will help us apply this knowledge on climate adaptation and mitigation.
Let's begin with a poll. So based on Carmen's presentation, which has been great, we could answer the following. What do we mean by climate change mitigation? Reducing GHG emissions, increasing GHG sequestration or absorption, or both? We will see your answers in a minute.
Perfecto. Gracias
Good.
por responder.
Thank you for your answers. And most of you selected both, and that is correct. If you replied reducing GHG emissions, that is fine. And if you selected increasing sequestration and absorption, that is also correct. But sometimes we focus on mitigation as reducing emissions, and that is great. But if we promote GHG sequestration and absorption, we will get a better result. So it's not just about reducing emissions, but also both, and we could do it through technology or by establishing further plans. So when we speak about climate change and where GHG emissions come from, we think about different sectors of the economy: transportation, energy, land use, and this is very important because sometimes we don't think that when we change the use of soil, deforestation, or when cities expand, we are destroying green spaces and environments. We are favoring not only emissions, but we are also reducing GHG absorption, combustions, fossil fuels. There are different areas in the economy that are associated to GHG emissions, and the most common is CO2. And these have global and long-term effects. There are other GHGs that have a local or short-term health impacts, and this is a shorter time scale. But these sectors of the economy do not only emit GHGs, but they also emit other air pollutants that have a direct effect on the health of our people, like particles. These are also associated to injuries in transportation, physical activity, or inactivity. If we all use vehicles to go from one place to another, the use of bicycles, for example, reduces, we become more sedentary. And for example, noise is also a factor, and diet. A diet, if it is very much based on beef, we will need a larger plot of land to raise cattle, and we are affecting not only GHG absorption, but these animals produce methane or other gases that have a very significant impact on the environment. So policies should reduce on reducing GHGs in the different sectors. So in these different sectors of the economy, this will have an impact on, well, CO2, a global impact, and also an impact on these short-lived contaminants in sedentary lifestyle, diet, and so on. We need to consider the benefits on our health, the benefits of implementing climate change mitigation measures on our health. The second poll, please. The poll refers to health determinants that are associated to climate change mitigation. So think about which of these elements could be associated to climate change mitigation. You can see different determinants, and we would like to know what you think. Which of these is associated to climate change and mitigation?
Veamos. Ojalá que puedan votar. Tienen varias opciones.
There are several options.
Perfecto, yo creo que podemos mostrar las respuestas.
So let's look at the answers.
Fantástico, muchas gracias por votar.
Great. Thank you for voting. Most of you selected all of the above, and that is correct. All of these determinants are associated to climate change mitigation. Most studies speak about the co-benefits in improving air contamination, and well, some of you selected that as the correct answer. So it's not just about benefits in air quality, but it is much more that we can do to see the benefits in healthcare. One of the sectors of the economy that has the biggest impact on climate change is transport and mobility, particularly in urban areas where the density of population and mobility leads to an increase in the use of motor vehicles. There are some cities around the world that are trying to implement policies to reduce GHGs and the impact uh, um, of this activity on air quality. For example, Barcelona in Spain. The mayor of Barcelona is implementing a new policy where they are going to shut down certain streets for motor vehicles and making them areas for pedestrians, bike lanes, green spaces for parks and recreational spaces. So the idea is to move from the baseline situation that you can see to the left of your screen to the super block model that you see on the right. This is a pilot project that's already been in place put in place in Barcelona. As you can see how that street was transformed. As you can see, motor vehicles are not allowed in this area anymore, and more trees were planted, benches, a square was designed, and there is more green space, and they eliminated the risk of traffic accidents as well. That study shows the effect of the super block policy that Barcelona has adopted in other places, in this case in Panama. Panama, Ecuador, and certain cities in the United States have carried out the study to analyze how to implement these policies that aim to reduce GHG emission, increase absorption, due to the increase of urban vegetation. What we did is we quantified the health benefits of the super block policy. That's a map of Barcelona. The dark lines show the super blocks that are being implemented in Barcelona. The mayor wants to implement over 500, and we wanted to measure the green space percentage. That map shows the vegetation present in different areas of our city, and we modeled what would happen in the future if these over 500 super blocks are implemented in Barcelona. And as you can see, there are more green spaces. We estimated surface temperature and heat waves in the city. We model what would happen in the future with this intervention, increasing green areas, and as Carmen said already, green areas help mitigate the effect of heat waves in urban areas. We also quantified enhancements and improvements in air quality, in road noise, and the maps show the before and after, right? The intervention is not yet completed, so we are trying to model what would happen in the future for decision-making purposes. That graph shows the number of deaths that we could prevent every year if we improve each and every one of these factors. For example, physical activity. If we implement super blocks across the entire city of Barcelona, there would be an increase in physical activity, and we would be able to prevent over 1,000 early deaths just by implementing this new model. Air pollution, we would prevent over 600 early deaths every year, noise, heat waves, and green spaces. We also estimated the annual morbidity in the case of disease, and the greater contribution results from a reduction in noise. And when we combine disease and mortality, we see great contributions and great benefits. This is the number of years lost due to early death or disability. This is a measure that is very widely used in public health, and the main benefits of this policy would be not only associated to climate change, but also in terms of traffic noise. There are almost over 18,000 deaths that could be prevented with this intervention. So what would happen if we promote other mobility policies? For example, the use of bicycles. Many countries do have this option to use bicycles as a mean of transportation, and we model the situation in 17 countries around the different continents, including Mexico and Brazil. We model what would happen if there were policies in place that promote bicycles as the main mean of transportation, and the results by 2050. And the current trend of the use of motor vehicles in developed countries is showing a slight downward trend in the 2010-2050 period. In developing countries, the trend on the use of motor vehicles will increase dramatically, and this will have a very important impact on climate change. Now, on the other hand, the use of bicycles in developing countries will go down. It is the red line. So the question here would be, if we implement policies that promote the use of bicycle in developing and developed countries, what would be the impact of these policies in the use of bicycles by 2050? And the dotted line shows the future impact. We are looking at the opportunity for urban cycling in the future. So what would be the impact on healthcare? What would be the impact on an increase of cycling in the health of our population? We included different motor shafts, many electric bicycles are in the market now, and we also included them. And we measured the impact on health of increasing physical activity, but also the risks when using bicycles. We will, when using bicycles, we will consider different impacts in air quality, in air pollution, traffic accidents as well, and traffic accidents leading to deaths. So this model includes benefits and risks, and what we quantified here is that if we're able to implement these policies by 2050 in Brazil, we would increase over 100% the use of bicycles. In Mexico, over 200% the number of bicycle rides. And in Brazil, this would mean a prevention of over 10,000 premature deaths every year in urban areas, and over 7,000 early deaths would be prevented every year in Mexico. So if we implement this policy by 2050, this could lead to the prevention of over 200,000 deaths every year just by promoting the use of bicycles. So what happens with other type of interventions or other policies? This is very important. These are the recreational bike lanes, and these are already in place in many cities in Latin America. And this study was promoted by an NGO in Quito, in Ecuador. They reached out to us and they requested for data about the impact or the benefit of recreational bike lanes in Quito, because the mayor was planning on removing the bike lanes because it really entailed a significant cost, but they could not see the benefit for the population. So what we did is we modeled 15 cities in 10 Latin American countries, as you can see on screen, and we quantified the impact on health of these recreational bike policy. For those of you who are not familiar with this policy, it means shutting down some streets in during specific days or Sundays for people to use as bike lanes, recreational lanes, yoga classes. It means that we are not changing the infrastructure, but we're changing the use of that particular infrastructure on one particular day a week. So we mapped physical activity, the impact on different diseases and mortality rates. And here are the results. Across the 15 cities, we observed that recreational bicycle lanes will prevent or reduce over 1,000 early deaths. That accounts for 1.5 million US dollars in that would be the financial impact on those cities. And this is the benefit of the bike lane, not only by reducing mortality but also reducing disease. So recreational bike lanes means changing the use of soil or changing the use of these streets will lead to an increase in physical activity and will lead to actual and observed benefits in the health of our population. And just to finish, we have discussed another policy related to vegetation and nature. Urban nature, vegetation, plants will have significant impacts on social determinants of health, temperature, UV radiation, noise, air pollution, and so on. There are different diseases that have been associated to green spaces and vegetation, from metabolic, cardiovascular diseases, death even. And what we did in this case, we quantified the benefits of increasing tree canopy, the number of trees in one particular city in the US. What you can see on screen is a map of Philadelphia, the city of Philadelphia. And we looked for one neighborhood with very few trees and another neighborhood with a more significant tree coverage. So the municipality wanted to increase the tree coverage by 2025. So what we did is we measured if they increase by 5% the number of trees, we would prevent 265 deaths every year, saving over 2.5 million. That will lead to over 2.5 billion benefits to the cities. And we model different scenarios of increases, a gradual increase of tree coverage, and as you can see, more deaths are prevented, and that will lead to greater financial benefits. This is the last poll. What are the climate change mitigation policies will lead to co-benefits in the health of our population? There are different policies on screen, and which ones do you think are more closely connected to healthcare or potentially have the greater benefits on the health of our population?
Si podemos ver las respuestas.
Now for the answers.
Fantástico.
Great. All of them. Most of you said all of the above, and that is great. All of the policies that you can see here are linked to climate change mitigation, and they will lead to co-benefits on the health of our population. So as health specialists, these are the tools that we can use and promote and help other sectors implement, because these will help our population.
These are the references I used for the presentation. Thank you very much for your time. Great, excellent presentation, David. I think we have about 10 minutes for questions, which I think is great because we will have the possibility of having you answer a few questions from the questions we have already received. Dr. Miranda, here there is a question from Jose Martin Cárdenas. He would like to know if we know experiences in the health sectors, hospitals, clinics, or other health networks that work with specific climate adaptation actions. The Pan American Health Organization, the WHO, and the CLAC as well have assessed the situation of several countries in Latin America. There is also a WHO document that collects the adaptation strategies as adopted by the countries. Some of these strategies have been applied to health services. So of course, we can share with you specific documents in this regard. Generally, they focus on implementing, for instance, solar panels to reduce electricity consumption, also avoid using fossil fuels and having better management of hospital waste. That was already the case in several hospitals or health centers because they have guidelines regarding hospital waste, for instance. So there are specific companies that manage this waste. But energy efficiency programs are newer. Some countries have standards set forth by the ministries of industry. And they state that new health centers that are built should use, I don't know, a given percentage of renewable energies. Otherwise, they're not built. They cannot be built. The thing is that these health centers are usually already built, and it's difficult to, change things as we go. But new centers should have renewable energy. Thank you, Carmen. David, a question addressed to you. Leticia Gomez asks if there is a successful example in Latin America of the increase in public transport and the reduction of respiratory diseases that you know of. There are several studies. One of the main success stories in Latin America regarding mobility policies are BRTs or bus rapid transit, or these buses or trucks that have one lane, and there are stations where you pay your fare to enter the station, so that the passenger flow when the bus stops is faster. These buses are commonplace in Brazil, in Santiago de Chile, in Mexico City. These buses have a specific lane for them. Some studies analyze the emissions of these buses regarding air pollution and their effect on nearby communities. We are conducting a study to quantify the co-benefits of implementing this type of public transport regarding mortality. We have included 2 cities in Latin America. In these cities, we have estimated the co-benefits regarding air pollution and also exercise and car accidents. Remember that public transportation is the safest in cities. So private cars are replaced, and this improves air quality, but we would also be improving road safety. I know there are co-benefits when we choose public transport. The bus station or the underground station is probably not right opposite our homes and this or destination, and that makes us walk for 5 or 10 minutes. If we were to multiply this over a number of weeks and number of months, this entails increased physical exercise, and this is also a public health co-benefit. Using public transport is one of the best policies there is to improve the health of people in cities. We cannot all ride a bike or walk to work. So public transport should be, you know, the main pillar of mobility within cities. Thank you. Carmen. We have a question regarding what has been said about mitigation of GHG emissions by the health sector. Toledo says that in Peru they have tried to reduce the GHG emissions in the health sector, but they based their efforts on the 2014 IPCC report that does not consider the health sector as a GHG producer. So in the latest IPCC report, is it clear that the sector is included as a GHG producer? Yes, this question is indeed very important because the health sector has been forgotten or hasn't been considered. And we always thought that it was just that needed to adapt. Okay, health needs to adapt to the disease. You're responsible for your patients, for this morbidity and mortality rates. And actually, national adaptation plans or NAPs in the area of health usually focus on that erroneously, that it's just health that needs to adapt. But that is not the case, because generally speaking, at the IPCC and also the Climate Change Framework Convention, every sector is included in the national adaptation plans. For instance, NAP cities, NAP agriculture, NAP transport, NAP energy. So we shouldn't feel that it's only us who should adapt, because with that name, because within each plan, each sector is trying to mitigate the consequences as well. And the WHO assesses the national contributed distributions. When you sign the convention, you undertake to implement the actions that are mitigation and adaptation actions. In the latest assessment conducted by the WHO, the WHO analyzed each country and its undertakings, and mitigation procedures have been detected, and they are being measured now, because we can actually promote their inclusion in the reports. Actually, these are already included. These contributions are included. So we should actually work hard in order for the health sector to have mitigation procedures so they're more visible. And we should also consider that there are several funds available by different organizations to help the health sector implement mitigation and adaptation measures. Well, thank you very much. We're out of time. Thank you, David and Carmen, for your excellent presentations. We have so many questions as asked by the participants, so we'd like to send you some of these questions so that you can answer them. And then we will send the questions to the participants. So thank you everyone again. Have a great afternoon or morning or day, and hopefully we'll meet again on Thursday for a final session. Thank you very much. Thank you. Have a great day. Thank you. Bye-bye.